Hello guys. So you can see we are planning to do the procedure of a thread lift. So these are the different vector in which we will be pulling the thread, and this is the target. We want to achieve the tighten look on the face, like we want to make skin to be more tight. So after doing a marking for the 4 different vectors, at the entry point we inject some amount of a local anesthesia, only just at the point of a entry, from where all the thread will go just behind the skin, just beneath the skin at the subacute level. Similarly, on the contralateral side, the opposite side, we are just cleaning with the spirit, the surgical spirit, and we are planning for the thread lift for the face. Thread lift is one of the tool by which we get the very much predicted and the desired result for anti-aging. Generally, the 4 different threads, we use it for the mid face and the lower face. So one is usually parallel to the nose, the second one and the third one is to address the nasolabial line or the laughing line, and the last one is towards the angle of the mandible. So this is how the 4 threads are generally divided. Now on both the sides we have done the marking, okay, and the thread is made up of a material called as a PDO. So the benefit of this particular material is when it dissolves generally after like 6 to 9 months, but whenever it dissolves, it motivates the neocollagenesis. What is neocollagenesis? So it motivates to have a more amount of a collagen fiber, and collagen fiber is very much helpful for youthfulness of the face. So after the local anesthesia is acted, so we have inserted the needle. We do not use any surgical blade or a scalpel or anything. It is just the needle that what we inject, like we just made a small piercing, and this is the thread, the first vector, the first thread. You can see, it's going straight towards the nasal bridge. It's important that you pull some amount of a skin when you pass the thread. Now you can see the thread is being passed. The thread has the grooves inside. So by doing this particular thing, we want to give reposition to the skin. So first thread is on. This is the second one. The second thread is being passed. So these are the cork threads, and PDO is a material name. So again we are doing the same. We are tightening the skin. So skin get hooked with the thread and we pull it in an upward direction. This is the third thread which we are placing. It looks very simple, but it requires some amount of a training and a practice, so you go into the correct plane. Otherwise there is a great possibility of a damaging arteries and veins, and there is a possibility of too much of a bleeding. Here it is almost a bloodless field, you can see. So correct plane in which you are supposed to pass a thread is very important. Once all the 4 threads are in, what we do is we pull the thread, we try to give a reposition to the skin, underlying skin, in the direction which we want to pull. So once that is done, yes, this is what we are doing. From all the threads we are pulling the skin in one particular direction to give the more youthfulness appearance on the face. The correct selection of the patient is very important. And after that you have to make sure that thread should not be come out. So you have to retract the skin little bit and then you cut it. Thread should not come out from the opening, which is very important. If someone is having the puffy face or too much amount of fat and the mass is appear on the face, then those are not the good candidate or not a good patient for a thread lift. Someone who is like this girl or someone who is a skinny, they will give a very good result. Now this is just immediate after the thread lift. On a one side, the right side, we have done the thread lift. The effect improves after 3 days, but even on an immediate basis you can see there is a difference. There is a left side looks much more rounder, while the right side, in which we have done the thread lift, it looks little more flat. So there is a tightening of the skin on the right side, the patient right side. Okay, and this is how the thread lift can be done. Okay, it is a 1-day procedure, just not a 1 day, it is just like a few minutes, like 5-7 minutes procedure, and almost painless, as you can see. Thank you so much. Myself is Dr. Vaibhav Shah. I am a maxillofacial surgeon. My practice is into the Mumbai, India. Okay, if you have any queries, please get in touch with me. Thank you so much.